Hello, and welcome to the Good Samaritan Health Services Virtual Gala. I'm Leanne Taylor, and I'm so excited to be with you. Good Samaritan has done some great things throughout the years, and I'm honored to be your MC. We have a wonderful evening planned tonight. The theme? A night at the movies. So get some popcorn popping like we have here in the studio and settle in for an enjoyable evening. Many of you have joined our galas in the past, but for tonight's virtual gala, we've had to think a little outside the box. So coming up, we're going to share some movie clips, highlights of this year's challenges and victories, as well as inspiring testimonies from our patients. First, we want to give credit where credit's due. An event like this can't go on without our sponsors. We're so thankful for their support. So please visit the sponsor page to view all this evening's sponsors. Just like past galas, there is a silent auction happening during this event. We suggest you watch tonight's program on your computer and use your smartphone to bid on items. The feature item, a 48-inch Samsung 4K television provided by Video Revolution. There's so many items available in the silent auction that you'll want to check them out. Now, if you haven't already registered for the auction, you'll need to do that now by clicking Sign In at the top right corner of your screen. Click the personalized link in your text message to make your bids or to set up automatic bidding. So now, it's on with the show. Here's something to think about. What would you do if you didn't have insurance? The financial barrier to health care is real. Here's an example of art imitating life in this clip from the movie John Q. It brings into focus that very question.
Yeah, we've recently switched carriers from a PPO to an HMO. It's a less expensive policy, but unfortunately there are some restrictions.
What kind of restrictions?
Here's how it works. Non-management part-time employees, such as yourself, only qualify for second-tier catastrophic coverage.
No, I'm not part-time, I'm full-time. It's just slow right now.
Sure, but your coverage is based on hours worked, and like I said, you only qualify for second tier, and that has a maximum payout limit of $20,000.
What? I mean, you guys been taking money out of my check every week. I've been paying into this policy for years.
Right, and that's why we're going to cover you for the full 20.
You kidding me, right? I mean, come on. All right, let me get this straight. You're telling me that you have dropped me from full-time to part-time. You switched carriers. Now you're telling me that I'm not fully covered, even though I got a policy that says I am?
It doesn't seem right, does it?
No, it doesn't seem right. I mean, my son is very sick. If I'm not covered, I got a serious problem.
I understand that, but there's nothing I can do. Look, you can file an appeal.
Yeah?
There you go. It takes about 7 working days.
Making health care available to the uninsured, that is what Good Samaritan is all about. They've been working to bridge the gap to quality health care for the uninsured or underserved in our community for more than 20 years. Let's take a look back to how we got here today.
Our story started when a handful of mission-minded doctors of In His Image residency program recognized the need of providing a medical outreach to the underserved and uninsured. In 1998, Good Samaritan Health Services was born with the idea of bringing together medical professionals and church congregations to serve our communities with much-needed medical care, regardless of the ability to pay. Our first clinic was located at the Fairmont Terrace Apartments in Tulsa. Among the first of the volunteers to help facilitate the clinic were a group of ORU nursing students. As the clinic gained recognition and patient visits increased, the need for both volunteers and medical professional involvement increased as well. Early on, In His Image decided to provide resident physicians to help handle the growing demands of the Good Samaritan health clinics. In November of 1999, a financial miracle came to Good Samaritan through a generous philanthropist. His generous gift provided Good Samaritan with its first mobile medical unit. Mobile capabilities allowed us to establish even more primary medical care clinics in the community. And by 2003, we were operating 6 clinic locations. As the clinics expanded, it became evident that another mobile medical unit was needed. In August 2007, our philanthropist friend came through for us again by donating a matching grant to purchase a second mobile medical unit. With this matching grant, our capital campaign was able to raise enough to purchase a 60-foot semi-truck with 3 exam rooms, a mini pharmacy, and a lab. That truck really came through, and by October we had grown to 11 clinic sites. Things were moving fast, and by 2009, our women's outreaches developed into monthly Well Women's clinics that are still operational today. While we were having great success providing mobile clinics weekly in various locations around Tulsa, we realized the need for a fixed site in North Tulsa, located in the Dream Center. With this clinic operational, we reached a milestone of 50 individual clinics per month. Since adding a third mobile medical unit in 2015, we have continued to grow and are now reaching many outlying communities with clinics in Sepulpa, Glenpool, Hectorville, and our newest location in Sand Springs. Good Samaritan Health Services currently hosts 12 clinic sites on a weekly, bi-weekly, and monthly basis. Through partner churches, along with their 250-plus volunteers, we provide holistic care through nearly 5,500 patients' visits and prevent an estimated 450 unnecessary emergency room visits each year.
So, you can see Good Samaritan has quite the history. We're so glad you joined us tonight, and we want this to be both informative as well as inspirational. So, stay tuned for more, and don't forget to keep up with the silent auction throughout the evening on your phone.
Your support tonight helps us to continue serving the uninsured and underserved in Tulsa and the surrounding communities with quality health care. We have 2 ways for you to participate tonight. You can give an online gift, or you can bid for some of our great items in the silent auction. Tonight we have a special patron who has committed to match your gifts up to $100,000. For example, when you give $100, then with a match, your gift becomes $200. What a great opportunity to make your gift count even more. Also, tonight we have a special online silent auction where you can bid on and win lots of great items. You'll need to register to place your bid, so if you've not already registered, you can do so by clicking on the Sign In button at the top right corner of this page. This allows you to get text notifications on the items being bid on and make changes as the night progresses. Either way, by your matching gift or winning an auction bid, you will be helping to support this very vital work.
Man, we're so excited. AJ from the Tulsa Dream Center. Welcome to Good Sam's first ever virtual gala. Thank you for partnering with Good Sam. What does Good Sam mean to the Tulsa Dream Center? We are their first and only fixed site, going on over 9 years in partnership. Tulsa Dream Center has 3 main pillars: food, medical, and education. And through Good Sam, its partnership, we're able to reach so many more people. Right now, our clinic is 3 days a week, and after meeting with Dr. Mitch and the team, we are expanding to 4, even 5 days a week. Dream no small dreams. Your partnership with Good Sam is partnering with Tulsa Dream Center. So thank you so much. Let's continue to change lives, to bring hope, to bring healing, and to bring the Word of God to so many. Thank you so much. Keep partnering with Good Sam.
If you've not checked out the live virtual auction yet, be sure to do so and get those bids in before 9:30 p.m. Tonight brings with it a special opportunity for all those who give during this event. A donor who wishes to remain anonymous has provided a matching gift for up to $100,000. What an amazing blessing. It means that tonight your gift counts double. Tulsa is an incredibly special place, and our community's always been generous. With your gifts, Good Samaritan's been able to branch out and serve not only Tulsa's uninsured, but many of the surrounding communities as well. At last year's gala, Good Samaritan revealed that they were working on a new location in Sand Springs. At the time of the announcement, the goal was to launch the new clinic before the next gala. Well, today that dream is a reality, and here's a little peek of how that all transpired.
Good Samaritan is an incredible partner for us as a church. They're really not interested in just growing their own brand or their own thing. They're really involved and engaged in what is our mission as a church and how does this fit together with that. The vision of our church is to see a city transformed for the glory of God, one life at a time. We are a church that want to be for our city, not just a church in our city. And so we've always prayed about what are the needs that we could address. One of our largest employers closing down several years ago, a big steel mill that left a lot of people in a lot of trouble there. Health is a concern here in our city as well, as we've just seen that to be an area that seems to send people down into poverty when they have those unexpected medical expenses.
Healthcare is expensive, and not only do we have those that just can't afford it, we have business owners that can't afford health insurance. Anywhere you're at, it doesn't matter what town, there's need in every community, in every town.
We had a doctor, Chris Place, who began to attend our church, and he made me aware of Good Samaritan. He shared with me that Good Samaritan had for a long time wanted to come to Sand Springs, but never had really felt like they had the right partner or the right opportunity. And man, it just became apparent that they were the right partner to really help us meet the need that we had here in Sand Springs. So I think some of the challenges that were greatest, at least immediately, were the expense and the finances of making the clinic happen, and then the volunteer force.
I think volunteering for Good Samaritan, it really opens your eyes to people in need in your community. I didn't realize how many people in our community are diabetic, and just to see all of them come and be able to get medicine on a regular basis is huge for Sand Springs. And to see the patients with a smile and with hope in their eyes, I see Christ in Good Samaritan, not only our clinic, but the other ones I visited. The prayer warriors are in there, and they are strong, and I see tears and I see happiness.
I love that Good Samaritan is passionate about the gospel of Jesus Christ, and really the opportunity for our church to be able to be the hands and feet of Jesus through this clinic, to be able to meet practical needs and practical ways to show the love of Christ in a practical way, I think is incredible.
I know one of our goals here in Sand Springs is to go every week, every Tuesday night. I see that as going to be a huge impact on our community, but we're going to need volunteers. I mean, that's just all there is to it. We need volunteers. Rusty and Scott Bryan both asked me about being site coordinator for here, and I accepted the position of site coordinator because I work in the administrative part of healthcare, and it was just a chance for me to work in the community along with face-to-face with actual patients in our community. Sometimes
They come in with so many other stories about what's going on in their world, what's happened to put them in that position to not be able to afford health care. And so people who are really hurting, people who, some of them who have lost everything that they had, whether it be by the floods back in May of last year or when a major industry in our city had shut down a few years ago. Just other challenges of life that have come their way that have really rocked their world. And so this clinic being available to them, just to give them a glimmer of hope, just to see them come in and their eyes light up, because now they're not having to delay getting the services and the care that they really have desperately needed for a long time. No matter the size of your church, no matter the economic, demographic of your church, you can partner with Good Samaritan in a way that's significant.
As you can tell, churches and volunteers are a big reason Good Samaritan can provide these clinics. As a matter of fact, they could not do them at all without the dedicated people who come forward to help. This includes church leadership, which provides the facility, and the many volunteers necessary to operate the clinic, including prayer support, doctors, nurses, data entry personnel, and so many more. Let's listen to some of our volunteers and hear what they have to say.
We found the heart of Christ in this. And there is no Baptist or Lutheran or Presbyterian or Anglican or anything else. It's just Christ. And we extend the hand of Christ and the arms of Christ through the volunteers that work in this ministry.
What I like about Good Samaritan is when you come here, it's a little different than going to a doctor's office because you're getting something extra.
I've worked in just regular medical clinics before, and there's not the loving human touch aspect.
People come and they're a little bit nervous, maybe a little bit embarrassed that they're in those circumstances.
And just to be there and to hear them say thank you, or just to smile for the first time in a while is really great. I love to see that.
They just say, I don't know what I would do without this, or I would have died if they hadn't have found what they found.
Yeah, quite often we get patients that'll say they feel like this home, or they feel like it's, a happy place to come. And I try to tell them it's the love of God that makes a difference.
I think the most rewarding thing for my volunteering is the feeling that God's getting glory. And that's what we're there for, is to glorify God.
It's awesome. It has been a wonderful experience. I wouldn't trade it for anything.
One of the great things about our clinic is that we have several different churches that are represented there. Church of Christ, Baptist, Presbyterian, Methodist, Anglican. And we've all come together and we love each other and we just come to serve the Lord.
Once you commit, the rewards are definitely there. And all you have to do is open your eyes and be a part of it.
Again, we're so glad you joined us tonight, so stay tuned for more. And don't forget to browse the silent auction items on your phone to find something special for you or someone you love. And let me draw your attention to these posters that we are using to decorate our set tonight. These one-of-a-kind posters were specially created for this event and are also part of the auction.
Here we have a juvenile onset diabetic with poor circulation and diabetic neuropathy. As you can see, these are diabetic ulcers with lymphedema and evidence of gangrene. Questions?
Any osteomyelitis?
None apparent, although not definitive.
Treatment?
To stabilize the blood sugar, consider antibiotics, possibly amputation.
What's her name? I was just wondering the patient's name.
Marjorie.
Hi, Marjorie.
Hi. Yes, thank you. Let's move on.
Good Samaritan's patients are real people, and each one is special to God. Good Samaritan shares Christ's love and compassion with each of them. The clinics provide holistic care for the patient's mind, body, and spirit. By listening to patients' needs and understanding their circumstances, the Good Samaritan team can address the entire person's well-being. Patients receive free of charge a doctor's consultation, lab tests, medications, health education for chronic disease management, specialty referrals, and follow-up care. Most importantly, prayer is offered to each patient. People come to the clinics to see the doctors, but Good Samaritan's heart is for them to find the true healer.
If I hadn't received the services from Good Samaritan and what they provided to me, I wouldn't be here today. I know that it was that close to the end for me. I'd gone there initially because of my knee, but later I developed some serious problems with my stomach. Dr. Carroll, that day, he called me into his office, and I could tell that it had really greatly bothered him, the news that he was getting ready to tell me, that it was serious. He sent me in for some tests, and I unfortunately had stage 3 cancer of the colon rectal cancer. After I was diagnosed, well, actually, after I realized that there was something seriously wrong with me, it was like the gates opened up. It was like all of these people had just been waiting for me. They like lifted me up, almost like angels in a way, and took me right down the path. At that moment that Dr. Carroll and Nurse Higby touched my life, everything changed. They got me right on to the right help that I needed. They got me through helping with all the paperwork and everything that needed for the charity. They helped me with guiding me through everything as far as getting the proper care that I needed. and the kind, the caring, the thoughtfulness, all of it, I did not expect. I did not expect it at all. So that was a defining moment with me. It was all the help. I didn't expect that at all, the care.
Patients with chronic diseases need care and access to medications, even while a pandemic is unfolding. At the beginning of the coronavirus outbreak, Good Samaritan made the decision to do whatever it took to continue providing medical care to patients. While other safety net clinics closed their doors, Good Samaritan made adjustments and implemented protocols so they could safely continue to provide the medical care to patients in need.
Our staff has been dedicated to doing whatever they are called upon to do to keep clinics operating during the COVID-19 outbreak. We have had to constantly make tweaks and adjustments to our clinic operations to keep our patients, volunteers, and staff as safe as possible. With many of our volunteers in high-risk groups, we've had to supplement with our staff members to keep the clinics going. Everyone has filled roles they would not usually fill. Having mobile medical trucks has allowed us to serve patients at alternate locations throughout the pandemic. We have operated clinics on a modified schedule, as some of our church partners, understandably, chose to close their facilities. Spirit Life Church graciously opened its doors to allow us to hold clinics at one of their buildings in place of closed sites. We are thankful for our volunteers who continue to serve and look forward to others joining our mission. Until then, we will continue to make modifications to our schedule and utilize staff to provide as much care as possible.
Staying open and continuing to provide care has not been easy, but the impact on patients' lives and the community makes it worthwhile. Let me share with you a few words from a wonderful thank you letter sent in by a patient who received the help she desperately needed during this coronavirus outbreak. Mary writes, "Due to the COVID-19 crisis and patient backlog, I was having difficulty obtaining medical care. Since I am uninsured, my options are very limited. I was feeling desperate. I was short of breath with lots of chest discomfort and was coughing constantly. Through Good Samaritan's clinic, a wonderful doctor immediately diagnosed the problem. I was able to receive much needed treatment and obtain the medicines I needed. I cried in the exam room with sheer relief." Patients send in letters like this all the time. People who had no other options were able to turn to Good Samaritan to get the help they desperately needed. Here's another example. Glenda writes, "Good Samaritan has been a godsend. I had to quit my job of 22 years to take care of my husband who had a massive stroke 9 years ago. He needs 24/7 care. I lost all my health insurance coverage, have no income, and don't qualify for any medical coverage. Without Good Samaritan's help, prayers, loving care, and all the individuals who volunteer at the clinic, I would be curled up in a ball fighting to survive." As you can see, Good Samaritan has had and continues to have a deep impact in the lives of the uninsured and underserved in Tulsa and the surrounding communities. This simply wouldn't be possible without your support.
My name is William Wilkins. I'm a volunteer physician at the Good Samaritan at John 316.
My name is Angela Martindale. I am a registered nurse volunteer at Good Samaritan Health Services, and I'm also a professor at the University of Tulsa.
My name is Marta Fisher. I'm a family physician, and I have been volunteering at Good Samaritan since August.
Kind of funny how these things work out, but I was at church one day just going through the bulletin, and I noticed the call for a physician to volunteer at this clinic, which I knew nothing about. Saw that little thing in the church bulletin and called Barbara Dunn, and next thing I know, I'm volunteering.
my purpose here was to just bring students. However, after a few visits here, seeing patients and seeing my students with patients, it was evident to me that I needed to be here as a volunteer outside of my employment with the University of Tulsa. Good Samaritan Health Services is unique in that they take care of patients who are uninsured, do not have insurance, and their ability to travel all over the community to see all different types of patients wherever they are is excellent and unique to any other healthcare facility that I've worked for.
Good Samaritan truly is reaching the people that need it the most. My life has been changed because of Good Samaritan, because I know I'm in some way expressing to others the impact that God has had on my life.
To have someone listen to them and to care about them and to pray for them, if their well-being and their soul is being taken care of, then it's going to come out in their physical condition as well.
Yes, it's a health clinic, but it's a health clinic that is really trying to forward God's plan for this earth.
That's what I like about Good Samaritan, is that it's paired with faith.
Sometimes I think, I'm just a nurse, or I'm just one person. What does my effort do or give? But when God's involved, He can take what we do, what we offer up, and provide so much more to fill in those gaps.
During this time, you've seen so much about Good Samaritan. I thought it was really important that we hear from the leadership. I'd like to introduce to you Dr. Mitchell Dunnick. He is the Executive Director of Good Samaritan. And what a wonderful organization that maybe some people are hearing about for the first time.
Well, thank you so much. I really appreciate your help. This is something we really feel passionate about. This is a big deal for us. I've been in healthcare all my life, and I'm just so honored to serve people. I think being in medicine, sometimes we get it mixed up and we talk more about the doctors than we do about the patients. Healthcare ought to be about serving people. It ought to be about loving people. And unfortunately, in our society today, there are folks that just can't access the system. If they have insurance of any type, they can get in somewhere, or maybe they're even on government aid and they can get in somewhere. But what about those people that just don't have the finances, but they don't have insurance? How do you take care of them? How do they get their diabetes taken care of, their heart disease taken care of? How do they stay well so they can keep a job? It's really, really important. And we just feel passionately that helping people be well is so important. We're blessed to be able to do it. We see in the life of Jesus that not only did He teach people, not only did He go around and talk to people about the kingdom of heaven, but He went around healing people. He went around helping people who had some real needs, and that's how we see medicine. When we talk about health care for the poor and for the underserved and for the vulnerable, we're talking about going to where people live, and we're talking about touching people. Many times they can't get to a clinic because they don't have transportation. Maybe they don't have language skills that fit in. If English isn't their language, maybe they can't fit in at that clinic. But we want to go to where they are and really meet that need. We feel it's so important. But it's more than that. It's more than just giving out medicine. It's more than just a blood test or making a diagnosis or even doing a treatment. That's part of what people need. But people also need help in their emotional realm, in the psychological realm, in the social realm with relationships. And we really believe addressing that's important. But more than that is the spiritual part. It's our love for people that comes from God. It's not innate in us. It's this fact that we know God loves us, and because He loves us, we can love people. That's what drives us. Because if you don't address some of the spiritual needs, some of the shortcomings and challenges that people have, maybe there's grief, maybe there's anger, maybe there's unforgiveness, maybe there's this whole idea of who am I and does anybody care about me? When we can address those issues, the spiritual, as well as the psychological and the physical, then we really think there's a chance that people can be healed. We call that whole person medicine, addressing the whole person. That's really what we want to do with Good Samaritan. We partner with people who provide food, who help with clothing, who help with housing. We bring the medical part, and that's what really drives us as we go out there. So I don't want anybody to be mistaken about, is this just another charitable organization giving away free stuff? Yes, but no. We're a faith-based charity, and we do give away free stuff, but the free stuff is the love of God, and it's medicine, and it's health care to reach people and to lift them up out of where they are. That's who we are. That's what drives us. That's why there's a picture of Jesus on the side of the van. That's why there's a verse that says, I've heard your prayers and I've seen your tears and I've come to heal you. That's who we are, and that's what we do. And you know, we just are so blessed to have people in this community, people in the Tulsa community that say, I want to help. I know I've got neighbors. My neighbors are people that maybe I know them, maybe I don't, but they're in Tulsa, and they're people I care about, and I don't know how to help them, but through Good Samaritan, maybe I can help them. Maybe we can form this partnership and be the body of Christ, that together people bring in their different gifts, their different talents, their abilities, their finances, their skills, and we can reach out to help those that are in great need, to serve those who are vulnerable, to serve those who, through whatever reason it is, they're in trouble, and that we can get them back on their feet, and we can bring them back to health in all these areas, and then they can fulfill the God-given purpose that's there for their life. So I just really want to thank you. We're in Tulsa, serving Tulsans and helping out in this community. And I'll just let you know that people have seen what Tulsa is doing and what's happening through Good Samaritan in Tulsa in other parts of the country, and they're saying, hey, maybe we could do that in our country. Maybe we could do that in our city. Maybe we could do that in our state. So what you are doing and what you're helping us to do and what we're all doing together through churches and volunteers and partnering together with hospitals and other physicians is a model of a way to serve people that are in tremendous need. So I just thank you so much for being willing to think about it, being willing to say, hey, maybe I could help out. What is it I could do? We have so many opportunities. I just met with somebody very recently and said, man, we need more clinics. There's more people that need what you are offering through Good Samaritan. We have places that are saying, could you come and do a clinic in our community? Could you run a clinic through our church? And really the answer is, we absolutely can. We absolutely want to. And if we had the resources financially to do that, we could find the people to do it, and we could add that, and we could do more. There's a great need. There are more opportunities, and we're really limited only by the resources we have. So thank you so much for partnering with us. Thank you so much for just stepping up and saying, I want to help out. I want to really be a part of this, and I'm going to step in financially. So as you give to support this ministry, I just want to thank you in advance. Man, we've got somebody that's really made a big commitment to help out and to even doubling some of the gifts that come in with a big gift. You've heard about that. That's just amazing. And it's amazing to me that you would trust us with your finances and with your resources and say, maybe I can't do that, but I can help you do it. Because when you help us do it, you're doing it. When we touch people, you're touching them because you enable us to do it. And that's really how the body of Christ works. Everybody bring what you have. What do you have? What's your strength? What's your ability? What's your talent? What's your gift? What's your resource? We put it together. People are blessed. People are helped. The kingdom of God is extended, and really the work of the ministry of the body of Christ happens. So thank you so much for doing that, partnering with us, and being a part of what's going on here.
I'm so grateful that you've been able to continue this kind of work given our current environment. And I know that many people are being blessed. You are kind of their last hope. So for that, take a listen to some of these patients who have come in to Good Samaritan and are so appreciative of all that they've received.
Who is my neighbor? And your neighbor is anybody that needs help. That's what that story said. And Good Samaritan is the perfect name for this organization. Sure is. It's for the people that certainly need help. I know I did.
My heart is always, God, thank you for them. Thank you.
I now have my medication, and it's approximately at a 6 for my A1C.
That's one thing that blows me away about this place. Everybody smiles here. And whenever you come in and check in, it's almost like you're a person. You're treated like a person, you know? They're glad you're here, glad you checked in. We'll call you whenever we're ready.
And so that's what I really want everybody to know, that Good Samaritans is there. They are definitely the example and the epitome of being a Good Samaritan.
I'm 100 times better than what I was before I started coming to Good Samaritan. I got off the streets and got into recovery, and it's just been it has been a transformation of my life, and I thank God for it, yes.
When you don't have health insurance, it's unattainable at times. It's scary.
On my darkness days of my life, Good Samaritan became a light into my life.
Somebody paid a bill that I couldn't pay, and that's grace. That's just like God saving me. It was grace, because I couldn't save myself.
Wow, just to hear all those folks talking about Good Samaritan and what it means to them.
It's amazing. You know, it's hard sometimes to really put it into reality what it's like. These are real people. These are people that are grandpas and grandmas and moms and dads and brothers and sisters, and they're in trouble and they're hurting. And I think that's where the whole Samaritan thing comes out of, like, who is your neighbor? These are our neighbors, and we have the opportunity and the privilege just to go and love them and be the hands and feet of Jesus. And like I said, get in with them and hug with them and pray with them and tell them, we hear you, we see you, we care about it, and the Father in heaven cares too. And we're here to let you know that, and we want to help in whatever way we can.
How would you not want to be a part of this organization? You're doing great work. And we want to remind you, the auction will continue till 9:30 tonight, so you can still place your bids. But we hope that you've learned a little bit more about Good Samaritan and shined a spotlight on what this organization is doing in our community. Thanks for being with us. Good night.
Thank you for joining us this evening. We hope you've enjoyed our presentation and learned a little more about Good Samaritan. If you'd like to make a donation, please go to our Make a Donation page. A donation of any amount makes a difference in the lives of those we serve. Our silent auction will be open until 9:30 p.m. Go to our silent auction items page to browse the great items we have up for bid. Your support is greatly appreciated. God bless you, and have a great evening.